In the east, notably at times of earlier conflict, we talk about Donetsk and Luhansk, helping the healthcare teams improve their trauma care capacity. And that relationship forged long ago has never been more important than it is right now, with Ukraine at war with Russia. Dr. Dan Deckelbaum is with me this morning, the co-director of the Center for Global Surgery, as is Daria Nomova, who is in fourth-year medicine at McGill, very involved in the project for all sorts of reasons, as you're going to learn. I'm delighted to have you both on the program this morning. Good morning.
Good morning.
Dr. Deckelbaum, let me begin with you. Obviously, a long-standing relationship with colleagues in Ukraine. What are you hearing from them right now in terms of what they are dealing with in this war?
Well, thank you very much for having us. And definitely, this is absolutely tragic and devastating. And they're having a tough time, obviously. But the healthcare workers there are extremely resilient, and they're working nonstop to provide the service to the communities. As you mentioned, the Center for Global Surgery has actually been working with the health leadership in Ukraine for about 12 years. And this relationship started about 12 years ago in Donetsk, as you were showing images of eastern Ukraine. This over time has progressed into Odessa, Kiev, and Lviv. And the reality is that if you can actually improve the baseline functioning, not during a time of crisis, of the trauma teams, then when there is a crisis, then hopefully you are better prepared to serve your population.
And Dr. Deckelbaum, in all of those centers you mentioned, we are covering attacks, and we are seeing just horrific war injuries. In terms of what your colleagues are facing, what are typical injuries of war, and what are they having to respond to in terms of, what are the conditions in which they're working?
Yeah, so the conditions are extremely difficult. This is clearly an austere environment. They're functioning in the basements of hospitals, where hopefully it's a little bit safer. They're working with very limited resources to provide care to injuries such as crush injuries, such as penetrating injuries from shrapnel, such as burn injuries. All of these things require urgent or emergent care in order to try to save the victim's life.
We're just hearing from the World Health Organization, Daria, that there have been at least 14 attacks on healthcare facilities and on personnel since the war began. So those conditions are indeed very dire. The injuries are very serious. And Daria, they need help, and you are providing it. Tell us a little bit about the videos that you are making and what you're teaching in them.
Yeah. The videos are directed at healthcare providers who are not typically performing these procedures. The auxiliary staff like nursing and respiratory therapists and resident doctors. The videos are aimed are trying to educate them at how to perform these procedures, like chest tube insertions and thoracotomies, and the settings.
Just pause there, Daria, because we have an example. I don't think it's too gruesome to show anybody. Some people might be a little squeamish about procedures, so just give them from it. We have an example of the video. So this is a chest tube placement. So tell us a little bit about one of these how-to videos as we look at it here.
Yeah, so as a medical student myself, this is how we're taught. So someone with medical knowledge but not yet hands-on procedures, this is the perfect example in a simulation setting in which you are showing how to insert a chest tube while walking the person through the procedures and things to look out for along the way. So things, anatomical landmarks that you want to avoid and guide you to do this procedure. So what we're doing is these were recorded by Dr. Deckelbaum and the rest of the trauma team at the Steinberg Simulation Center, and then we arranged volunteers to overlay the Ukrainian text to facilitate the delivery of this to Ukrainian healthcare workers.
Because, I mean, it sounds like it would be a refresher, but you made an earlier point that was really important. The people who are having to do those in a war, they're not necessarily trauma specialists, are they? It's all hands on deck. They might not be doing more common procedures. Is that right?
Correct, and then in the settings where you have more trauma than trained specialized hands, this is the approach that a lot of healthcare facilities have to take: is recruit additional personnel and teach them what you can on the spot, obviously with safety in mind. And these videos are just some of the ways in which we can contribute to that recruitment.
Dr. Deckelbaum, if you could join in now. I know you've been meeting regularly with your colleagues, and if I'm not mistaken, you have a meeting with them today. I don't know if you had that already or if it's coming up later on today, but what is your sense from them about how important these videos are going to be as they face these challenges, and how they appreciate your assistance in this matter?
Yeah, as Daria said, unfortunately, there just aren't enough emergency physicians. There aren't enough surgeons or trauma surgeons that are available to respond to the significantly increased load of patients that come in with injuries. So the idea is to try to task shift and give some of the skills to physicians such as family doctors, such as internists, dermatologists, et cetera, that don't usually practice these types of interventions, and to literally just give them a refresher. They have a skill set or an educational platform where they can now be better prepared for the performance of these procedures. This is something that, in the different hospitals where that face this type of patient population, which is pretty much across Ukraine now, is essential.
As the numbers go up, and so many children as well, which is even more challenging to deal with this in a pediatric context, I'm sure. Daria, if you would, your story, this is professional for you as a medical student, but also personal. You came to Canada 11 years ago. You are yourself Ukrainian, and I'm just wondering, how are you? And how are your family and loved ones there?
It's been an extremely difficult time. As you can imagine, we count every single day. Today's day 12 of the Russian invasion. People live day to day. I start my day by calling everyone and I know over there and reaching in and making sure they are okay today. They've survived the night. Some of them have to sleep in their basement. Others have to go to the bomb shelters. It's been an extremely difficult time, and it's both. We're talking about physical trauma here, but implied is the emotional trauma that is going to be affecting all of us over there or here for a really long time. And those are also the needs that we'll eventually have to address.
Yes.
But here as a community, I'm part of the Ukrainian community, and we're doing all that we can here as well. So on top of the surgical interventions, I'm trying to help here on the ground, preparing for migrants that will surely start coming into Canada in a few weeks.
Well, indeed. I mean, one of the things that's been so impressive, Daria, is to see Ukrainian citizens doing whatever they can to help in the resistance in any way they can. And even though you're far from there, you're one of the Ukrainian Canadians doing similar things. What does it mean to you to be able to have a role in this way?
It's extremely meaningful, and it's the way to cope, really. I personally have all this energy and guilt even that I perhaps should be there and should be doing more. But it's a reminder. I remind myself every day and my colleagues who are here in Canada that the best that we can do is maintain stability for ourselves and for our community, so we can help rebuild and help our Ukrainian fellow Ukrainians when and if this is over. And I remind also everyone that even if you're not Ukrainian, you could help. Right now, donating to humanitarian funds like Red Cross or Canada Ukraine Foundation is the best way a Canadian could help.
Thank you, Daria. And Dr. Deckelbaum, last word to you. As you listen to Daria and see how invested she is in your program, and you see your colleagues there in Ukraine rising to challenges that perhaps they never trained for and never imagined they would face in their practice, what is your appreciation?
I think all the credit, we wish we could do more, but all the credit goes to the healthcare teams, the physicians, the nurses, the respiratory therapists, everybody that's working in the hospitals, the paramedics in Ukraine. Their teams are extremely well skilled. They know what they're doing, and the commitment that they've shown during this crisis is incredible. They're extremely resilient. They're committed. They're strong, and it's been an honor to be able to work with them over these years. So all the credit goes to them. And in fact, the Ukrainian community also here in Montreal and the rest of Canada, which has been extremely supportive of the activities in Ukraine.
Well, I bet they can't wait to get those training videos and help them in these very difficult days ahead. Thank you so much, both of you, for the time today. Really appreciate your sharing what you're doing to help. Daria Nemova, Dr. Dan Deckelbaum in Montreal. Thank you both. Dan Deckelbaum in Montreal. Thank you both.